My name is Bret Pasiuk. I'm a nephrologist and I practice here in Fond du Lac, and I also see dialysis patients in Beaver Dam. Nephrology means study of the kidneys, and what it means to me is I work with kidney problems. I treat problems of the kidney and a lot of high blood pressure. So high blood pressure goes along with kidney problems. So I treat kidney problems and the associated high blood pressure. I chose nephrology because it reminded me of a lot of my former work in naval engineering. I have a background in naval engineering, and the patients that or the problems that kidney patients have are similar. They have problems with the filter, the kidney, the pump, the heart, and the blood vessels or pipes leading from the heart to the kidney. So working with nephrology patients when I was a medical student and when I was an internal medicine resident reminded me a lot of my job as a naval engineer. And so it was a natural specialty for me to fall into. I think what really makes Agnesian a good choice for patients is our electronic medical record. All the specialists communicate each other very easily with the electronic medical record. So a patient, when a patient comes into the hospital, we can look at the notes from their primary care provider, get their medication list, see their problems, and make sure we address all those problems while they're an inpatient. And likewise, when they go back to see their primary care doctor after they've been discharged from the hospital, the primary care doctor can look online and see exactly what happened in the hospital, what procedures were done, what medications were changed, and from there, make sure all bases are covered. My hobbies and interests, besides taking care of the 2-year-old twins, I'm a history buff. I read a lot of history. Most of the recreational reading I do is either naval history, U.S. history, or European history. I also run for physical and mental health. And then my wife was stationed with the Navy in Italy for 2 years, and we took Italian cooking courses together over there. We both enjoy cooking. I chose Agnesian HealthCare because I admired how integrated Agnesian was within the community. You go around Fond du Lac, you see the Agnesian signs on buses, you see the billboards, you see Agnesian sponsoring various cultural events in the city. That impressed me when a hospital is so involved in what the community is doing. And I think it makes for a good relationship between the hospital and the community and vice versa.